Imposter syndrome in students, faculty, and staff. Imposter syndrome you'll also sometimes see called imposter phenomenon. And I think we've probably all felt this at some point. That is that sensation that it cannot be correct that you are the one who was there teaching that course or giving that talk or talking to that client because you can't possibly have the right level of knowledge and training to do it. And so this is that odd sensation that despite your training and the knowledge that you have, you should not be the one who is performing in whatever way you are performing at that moment. Imposter training is seen in people at all levels of training and accomplishment. Even people with many degrees and years of experience will sometimes feel like imposters. And sometimes it's due to an internal thing. Some people really have trouble sort of recognizing that, yes, they do have that level of achievement, and that's why they feel like imposters. Some people have more of an idea that, well, yeah, I'm here, but I got here by luck or by opportunities that arose. And then they will feel like imposters instead of feeling like they really did something positive to achieve their level of standing or their current job position. It may be more common in perfectionists, and you see the whole list on the right-hand side here. Perfectionists, superheroes, like people who are just really trying to take on too many roles, experts who really feel like anytime they have to say, I don't know, that's a failure for them, natural geniuses that just have basically not had to work real hard, and then when they start to work hard, they feel like, wow, this is abnormal. I shouldn't have to do this. And then finally, soloists who just feel like I should be able to do this by myself. I shouldn't need any help. So you can see there's lots of different personality types that would tend to sometimes feel imposter syndrome. And sometimes it's very specific to a context. You're being asked to speak at a meeting where you feel like everybody in the room is more knowledgeable than you. Things of that nature. When surveyed, over 80% of veterinary students and over 70% of working veterinarians, practitioners, reported occasionally feeling like an imposter, at least occasionally, and so some of them much more than occasionally feeling like an imposter. In the 2021-2022 academic year, Drs. Emily Burrell, Aaron Burton, and Pearl Zhitnitsky surveyed our students, specifically the fourth-year students, and they reported that 50% of those fourth-year students felt fairly intense feelings of imposter syndrome at the beginning of fourth year. That improved over the year. Fewer of them felt so intensely as imposters, but there was still a certain percentage of students that felt like imposters pretty frequently, even as they finished up their training. So this is a common thing among our fourth-year students. We see fourth year as this wonderful opportunity for them to finally get away from the books and explore the world of clinical medicine. But for many of them, they have this sensation that they shouldn't be there. They shouldn't be allowed to be doing this work. Specific triggers that those fourth-year students described included being asked to perform technical skills, so they were less confident of their ability to perform technical skills, concerns about the perceptions of them by clinicians or residents as they answered questions, as they spoke, as they tried to perform as a clinician, taking the NAVLE or the National Board Exam, and then anytime they received negative feedback, that made them feel like an imposter. And that's something that I think we need to address as a culture, helping them understand that we all receive negative feedback and that should be constructive. And as hard as it might be, we need to try to take that as a learning opportunity. For veterinarians, there was a study published in 2020 in the Veterinary Record, which is a British journal, and they talked to 941 practicing veterinarians via a survey, and they found that 60% of those respondents had felt like an imposter, and in that particular population, women and veterinarians who had been in practice for fewer than 5 years were more likely to feel like imposters. So pretty much any time you have someone who's new to what they're doing, any veterinarian who's new to practice, research, or teaching, young veterinarians as they're finishing out, they're probably at least occasionally going to feel like imposters. And anyone, any faculty member, staff member, whoever you are, as you move through your career and you take on new job responsibilities, there will be a period of time that you may again feel like an imposter who was perhaps given that role inappropriately. There is an emotional cycle of imposter syndrome, and you see it shown here. Number 1 starts out there on the left-hand side. You get a project or a task. It's a new thing. Number 2, you feel imposter syndrome. You shouldn't have been asked to do this. Number 3, you figure out a way to kind of adapt or cope with it. You procrastinate. You eat a lot. You go ask somebody for an enormous amount of help and just spend an inordinate amount of time looking things up before you go do it, whatever your adaptive thing is. Number 4, you do it. You're successful. Number 5 is the problem, because then you feel like, wow, apparently every time I get asked to do something new, I need to eat a lot and then read just excessive amounts of information or procrastinate. Whatever your adaptive thing was, you take as a necessary thing the next time you feel like an imposter. And it's important for us to think about this cycle, because we need to understand that imposter syndrome is a normal sensation and isn't necessarily something we have to create an extensive system to help us deal with every time. So what can we do about it? Number 1, don't stress about it. It's a natural phenomenon. It would be really unusual for you to start at a brand new job. You don't know the people, you don't know all the equipment in the place, you don't know what the culture is there. For you to not feel out of your depth, that would be abnormal. And so it probably makes sense for you just to recognize sometimes I'm going to feel like an imposter and I just need to give myself some time. And if you have new coworkers who are pushing you a little bit, remind them you just started this job and you need some time. It's not a bad thing to remind people of that. Everyone needs time to learn new skills and to learn a new environment. Secondly, find ways to use your strengths. So there are certainly times that as a teacher, I have felt like an imposter, thinking I shouldn't be trying to teach this topic, or I don't know enough to be teaching this class. But boy, I have found that teaching really helps me get beyond that imposter syndrome. When you say to the students, I don't know that, let's look it up together, or let's talk it through, it does become clear that there is a lot that you know and a lot of things that you know how to do that the students don't know yet. Teaching, while it may make you feel like an imposter originally, at least in my hands, has very often helped me grow away from it as I talked through things with the students. Number 3, talk about it so it's not a hidden problem. If everybody in the room is feeling like an imposter and somebody says, well, I feel like an imposter, that makes all the rest of those students feel better. Whereas if the students never feel like they could say, wow, I feel really unprepared for the cases that are coming in today, then that's just a horrible psychological burden for that student to bear. So if it isn't an uncommon thing, and clearly it is not an uncommon thing, we should talk about it, and so that we can help others feel more comfortable as they work through it. And then finally, if it is a bad enough concern for you, if it's difficult enough for you that it's impacting your life, your professional life or your personal life, then you might want to consider seeing someone to help you really talk it through and to come up with strategies that are going to help you cope with it. If you have any questions about imposter syndrome or anything I've talked about in this teaching tip, I'm Dr. Peggy Root, and I'm most easily reached by email. My email address is rootk001@umn.edu.